collagen process.
Thank you, ma'am, for this opportunity. And I'll be talking about a very specific and specialized treatment for keratoconus. Now, as very nicely has been explained by Professor Tijal, sir, that keratoconus is a disease wherein you have a conical protrusion of the cornea becomes steep. So the idea is to flatten it. And that is why these Intacs are segments, arc-like segments, as you can see here. These are made of PMMA, polymethyl methacrylate, and these are inserted in the peripheral part of the cornea so as to cause a flattening of the central part of cornea and to correct the myopia and astigmatism associated with keratoconus. Now, just briefly, I will tell you how it works. Basically, this is the a segment which is inserted into the corneal stroma. So it separates the corneal lamellae. It is inserted at the level of 70 to 80% of depth. And what it does is, as you can see here in the picture down, that it shortens the arc length. So it shortens the arc length of the cornea within the intact segments. And that is how it causes flattening and results in correction of some degree of emmetropia in keratoconus. I'll just show you a small video clip how it is done. The center of the cornea is marked. And once you mark the center of the cornea, this is femtosecond assisted creation of tract. So within the cornea, you have to create a path through which you can insert the ring segment. And that is what is done either with a mechanical separator or by the use of laser, which is femtosecond laser, as it is being done here. So as you can see here, the path is being created. And this is a radial incision that has been made through which these intact segments are introduced. So the first initial part, the path is separated by a separator. And once it is done on both sides, then you place the intracorneal ring segment into this tract, and it is progressed forward. So on one side it has been done, and then the same way it is done on the other side. And after doing both this, extremely sorry for this. After doing both the sides, you put a suture to close this incision. And then in cases of keratoconus, you debride the central part of epithelium within the area which is there within the intact segments. And then you do cross-linking. A detail of cross-linking will be discussed by Dr. Namata. And this is how it looks like in the post-op period. These are the intact segment. And what happens that the central arc length is shortened. So it is flattened, and thereby, by flattening, it reverses the steepening that is there in the disease called keratoconus, and thereby bringing about some correction in the emmetropia created by it. Just a few words about the planning of the surgery. It depends on the type of cone. Cone can be centered cone or decentered cone. If you have a centered cone, then in that case, you put symmetric segments. And if you have a decentered cone, you put asymmetric segment, means the segments are of different thickness so that you create correction differentially. Just an example, a case of -4 diopter sphere and -4 diopter cylinder at 40 degree. So in order to decide about the incision, you convert it into positive cylinder form. So -8 diopter cylinder with +4 diopter, -8 diopter sphere with +4 diopter cylinder at 130 degrees. So the incision will be put at 130 degrees. So here is the incision. And since the posterior float shows that the cone is central, you can put a symmetric cone. Another example, you can see here the float is showing that this is an asymmetric cone. And in such cases, it is better to have a differential treatment. So you put a thicker segment, you put an asymmetric segment. So a thicker segment is put here and a thinner is put here. So as to create a differential treatment and correct astigmatism. Sometimes in an asymmetric cone, you also put a single segment. Like in this case, a single segment has been put. This is the incision, and this corrects the irregularity that is seen in cases of in corneas in cases of keratoconus. So in conclusion, intracorneal ring segment is a specialized treatment which is done in cases of keratoconus to regularize the surface, to flatten the central part by inserting one ring segment and flattening the central part of the cornea. And it is combined with cross-linking so that once you regularize the surface by putting the ring segment, you can stiffen the cornea by use of corneal cross-linking. And that's how you bring about the visual rehabilitation by further means, by contact lens, etc. But you correct a significant degree of ametropia, particularly astigmatism in cases of keratoconus by intracorneal ring segment. So thank you very much for your patience.